Why are ictal and interictal EEG patterns important for epilepsy diagnosis? Imagine trying to understand a complex puzzle without seeing all the pieces. That's similar to diagnosing epilepsy without looking at brain activity. Electroencephalography, or EEG, is a key tool that helps doctors see the electrical signals in the brain. These signals can tell us a lot about whether someone has epilepsy and what kind it might be. The two main types of EEG patterns are ictal and interictal, and both are essential pieces of the puzzle. Ictal EEG patterns are recorded during a seizure. They show the brain's electrical activity as the seizure happens. These patterns often have distinctive features like rhythmic fast waves, spikes, or sharp waves that change as the seizure progresses. Seeing these patterns helps doctors confirm that a person's events are truly seizures, not other conditions like fainting or psychological episodes. It also helps locate where in the brain the seizure starts, which is especially important if surgery is being considered. For example, if the seizure begins in the temporal lobe, the EEG can reveal that, guiding treatment decisions. Interictal EEG patterns are recorded between seizures. They often show abnormal discharges called interictal epileptiform discharges, which look like spikes or sharp waves. These signals suggest increased brain excitability and a higher chance of future seizures. While these patterns are common in people with epilepsy, they are not always present. Their absence doesn't rule out epilepsy, but when they are seen, they support the diagnosis. The pattern's location can also help identify the epileptogenic zone, or the part of the brain responsible for seizures. Both types of EEG patterns are vital in diagnosing epilepsy. They help confirm the clinical suspicion, differentiate epilepsy from other conditions, and classify the type of epilepsy. This information influences treatment choices, such as medication or considering surgery. Sometimes, prolonged EEG monitoring or video recordings are used to catch seizures that happen infrequently, increasing diagnostic accuracy. It's important to remember that EEG results are just one part of the diagnosis. Some seizures may not produce clear EEG changes, especially if they originate deep inside the brain. That's why doctors combine EEG findings with clinical history, brain imaging, and other tests. Proper interpretation requires expertise to distinguish true epileptic patterns from benign or artifact signals. Overall, ictal and interictal EEG patterns provide objective, valuable evidence of brain activity related to epilepsy, helping ensure accurate diagnosis and effective treatment. Always consult healthcare professionals for personalized advice and management.